There we go. Hopefully you can all see my screen.
All good.
Then I've got to work out how to go between the slides. Right, so Jane kindly asked for me to do this presentation. Some of you would have been possibly at the HFMA conference earlier on this year, and I presented the innovation that Norfolk Community Health and Care Trust put in. And on the back of that, that's what I've pulled together in terms of this presentation. I still am employed by NCH&C. I'm currently seconded into the ICB, so I have two hats on. But yeah, so I thought, right, let's keep it simple, because that's what you want, people. Nice and simple, nice and easy to follow. So let's hope it moves on. Right, let's try that. There we go. So what's the point? What's the point of putting an innovation in? Because a lot of us keep talking about how busy we are. So this is the context. Why do innovations? Well, it provides a means to share big and small ideas. It's all about the workarounds that we've all found in our own jobs. And it's also, as with the previous presentation, finding new ways of working and putting that in and sharing it and having a platform to share it. So I actually come from a commercial sector. I used to work for Unilever for a couple of decades, and they had a thing which was invent once and deploy. Stop faffing around. If somebody's got a good idea, get it in and deploy it out everywhere so everybody gets a benefit from it. But it is about that. It's about doing that. It's about it's preventing the reinvention of that sad old wheel that we have. And it's about borrowing with pride, going, God, great, they've had a great idea. We'll do it instead. Excellent. On a slightly different note, it is a requirement of an FFF accreditation. So even if you can't be motivated in any other way, that's quite important. So that's part of the requirement for going through the accreditation process for the different levels within the FFF. So how do we do it? What's the process? So I had to go and remind myself what the process was. And I've tried to make this as simplistic, but have everything in the presentation, which I'll email to Jane at the end so it can all be shared around. So the first thing you have to do is to find the One NHS Finance website. So for anyone who's never been on it, you just have to Google it, and there it is. It's quite easy to find. I've put the link in here. Then there's a box which I've copied on the right hand side. You have to click on the Finance Innovation Programme, discover more. Gives all sorts of background in there, lots of stuff to read. It also gives you the submission guide. It also gives you the link to actually submit an innovation. And there's also the innovation library in there with all the different innovations that have, is it about the past 2 years, or am I being over generous? It is about 2 years that it's been going. I've also put the link in there for the innovation that NCH&C did. It's a bit of self-promotion there. The important thing is to register, because if you don't register, you can't get to access everything. And it is so easy to do, because I had to re-register myself with my new NHS Net email so that I could get back into the system. It is so easy, and you get an email straight away and it's done. So it's not difficult at all. What I've put in here is the frequently asked questions from the submission guide. The submission guide is quite big, but these are I went straight to frequently asked questions is always the place to go to, because 9 times out of 10, the first question you'll be going, oh yeah, that's the question that I have. So I'm not going to go through these in detail. I will be making time up, Daryl, you'll be impressed. There's lots in here, but there's lots of stuff in here which says what your word limits are, how to fill it out, how to kind of set it up so it's easy to follow. Because the people who review these are known as peer reviewers, and they're just people like us who have a lot of stuff to read through. So if it's all in a consistent format, then it's easier to read, easier to understand, and easier to follow. So I won't dwell on the frequently asked questions because they are useful, but there's 14 of them, as I found. I assume they get added to as more ones come up. But so what happens once you've submitted one? The excitement is it gets reviewed. If it's accepted, it gets reviewed by peer reviewers. And if they approve it, and it's just people, you and I, doing this. It then gets published, and then the person who's put the innovation in becomes the owner of that innovation page, and you can add extra bits in, extra bits of information. Has it improved? Has it changed? Has the scope widened? You can add elements in, so it keeps it as kind of like a live library, which is really, really useful. I think it might be on my next slide that I did this. Oh, that's not so good. Oh no, I'll go back. Here we go. So for me, learnings and benefits, keys. So the thing that I learned when I presented at the HFMA conference, and I went last, and I was after Daryl, and I'm sat there going, oh my God, all these projects are massive and they're strategic, and it's all about, you know, really good ways of working and stuff. And I presented a purchase to pay non-PO innovation, and just thought, oh my God, everybody's going to think this is really boring and tedious. However, it was really pragmatic and everybody loved it. So that was a learning for me, because I was starting to pap myself as I was sat on that stage waiting for my turn to go last. So it doesn't have to be spectacular. It's about, I found a workaround, or I found a better way of doing something. Here it is, and I'm sharing it with everyone. The other good thing is become a volunteer to be a peer reviewer, because then you start to see some of the innovations come through and what format they're in. And then it kind of gives you that insight. If you're worried about submitting an innovation, that's a good route to go. So that's what we did in NCHC. There was, I think, about 2 or 3 of us who did peer reviewing. And the thing for me is about curiosity is a key. It's not doing the same thing every single day, in and out, because your predecessor did it, or because that's the way we've always done it. It's about going, well, that's really irritating. Actually, there must be a better way of doing that. And it's just being curious. And a lot of us have been so long in jobs, we're like, oh, I've just got to get through it and it's fine. But actually, we all have those ideas. We all have those ways of understanding and finding a new way of working. So all I've said is get your teams to look at the existing innovations and start to use those resources. I had a really good guy who worked for me in NCHC that I'd pose him a problem. That's one of the first places he would go to, would be the innovation library, to see if anybody had done anything on it. And you can use search mechanisms, and there's search tools on it, etc. And I've also put some useful email contact details on there as well. There you go. That's me done. Any questions? Woo.
Thanks, Helen. I have to say that Helen's done a great job of describing it. It is that simple. Just get on and do. That's all I can say to you.
And it's like an exam. So if it's really crap, it just doesn't go any further, and it's okay. You don't need to tell anyone. It's a lot easier.
Okay, brilliant.
All right.
So I think Paul has come on screen. So, oh, Jodie's got a hand up.
I was just going to say really quickly, what Helen made the point about reviewing the innovations that are on there, and that's a really good point. So at NSFT, we split the finance teams into different groups, and then kind of allocated 6 or 7 innovations to each group, and then they fed back and said, this is really good, this isn't relevant to mental health, or we're doing this already. But we've picked out like 4 or 5 that we're just like, this is so good to implement. So that's one way of doing it. It's like sharing out the innovations, allocate them between your teams.
That's a good shout, Jodie. Thank you for that.